My back hurts. What's the best stretch for me to do? Hi, welcome to our Ed Talk series, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. I want to answer this question because I get asked this a lot. I get a lot of patients that come in with back pain, and I'm going to just start this video to let you know that it's not a clear-cut answer. However, what I see with patients a lot of times is they focus on the back or the hamstrings where their pain is originating. They feel the pain in the back. So logically they think, oh, I should stretch my back or I should stretch my hamstrings, reaching out and trying to touch the toes. And those may be good stretch and that might be exactly what you need. However, what I find with a lot of my patients is they're actually really tight in the front of their hips, and that's causing a lot of their back pain. So I want to go over just a little bit of anatomy so you know what I'm talking about and why we want to focus on the hip flexors. And then I want to show you a quick hip flexor stretch. So let's get started. First, I want to go over a little anatomy. So when people say my back hurts, I always ask them, what part of your back? Is it your lower back or is it a little bit lower, maybe into the sacral area? So it is important to know where your pain is coming from. But regardless, I'm still going to show you a little bit of anatomy and the stretch that I want to share with you today. So this is the spine here. You can see how it's stacked up, and we see the pelvis. The pelvis really makes like a ring, a circle, right? So we have a right half of the pelvis and a left half. They meet in the front at the pubic bone, and as they come to the back, they actually meet up and kind of sandwich this sacrum. So you see this little triangular piece here, the very tip of it's the coccyx. So that's your sacrum, and the SI joints are where the sacrum and the ilium from the pelvis meet up. So you might be having pain in your SI joint or joints, or it might be into your back. So you can see how the spine, the lumbar spine stacks on top of the pelvis, continues up to the thoracic spine and up to the cervical spine in your neck. So I want to talk to you a little bit about where the hip flexors actually attach here and why it may be causing some pain in the back. Here I have an illustration from Pelvic Guru. I do have the copyrights to use this image. You can see here as you're looking from the front, you can see the pelvis. So imagine again that that's a ring going around. And what we have here are some of the muscles that attach. So we're going to see the psoas muscle. So the psoas muscle, imagine that there are one on each side. They come up and they attach onto the front side of the lumbar spine and onto the intervertebral discs between the vertebra. They come down and they meet up with what's called the iliacus, this muscle here, and they blend together and they create what's called the iliopsoas, which attaches onto the inner and very top part of the thigh bone. So I want to show you on this model. So going back here, those psoas muscles, which are called the hip flexors, you can collectively call that iliopsoas, that complex, the hip flexors. Most people understand those are coming from the front side of their hips. They attach onto, again, the front side of the vertebra and even onto the diaphragm, onto the intervertebral discs. They come down and meet up with the iliacus, which fills this space here on both sides, and they blend and they go down. I don't have a thigh bone that is attached. Your hip actually attaches on the side here into this hip socket. So those muscles come down and attach onto the inner thigh. So can you imagine if those muscles are tight and pulling onto the back? And I tell my patients it's kind of like a fist, just pulling in and pulling you forward. And a lot of times what happens with that is, if you can imagine from the front side, me being tight here, it's going to pull me forward and it's going to cause a little bit of an arch in my back. Imagine that you're standing like that and sitting like that and going about your day, how that can cause some strain in your back. Now, I do want to tell you that there's a lot of different reasons that you might be having back pain, and it's hard to answer all of that in a video for everybody. So to be honest, the best thing for you to do is actually get checked out, get assessed, go to a physical therapist, go to your physician, and see what's actually going on. But that in a nutshell helps a lot of my patients. So again, going back to this diagram, again, you can see how those muscles come down, they blend and come into that inner thigh. So how do we target these muscles? How do we stretch the hip flexors? I'm going to show you that right now. There are different ways to stretch the hip flexors. I'm going to show you one way and talk to you a little bit about some alternative ways as well. What you can do, I prefer to do this in kneeling. So go next to a wall or have a chair handy. That way you'll have a little bit of support for balance. You might even want a pillow or a folded up blanket for underneath your knee. If you have knee problems, this might not be the best solution for you. What you're going to do is you can take that pillow, place it down. If you need padding, I'm going to go ahead and not use it so that way it's not in my way. What you're going to do is come into a kneeling position like this and hang on to the wall if you need it, and put one foot in front of the other. So you can see my right leg is in front, my left leg is back. I'm going to be stretching my left side. I'm going to hang on to the wall. What I'm going to do first is kind of tuck my pelvis underneath me and set it. Then I'm going to start to go forward, almost like an unlunged position, and that's going to give me a nice good stretch along the front of my hip, maybe down into the quad as well. Now, I tell you to tuck your pelvis underneath, because if you don't and you just kind of here, like this might be your natural, you might be able to come really far forward and not feel any stretch at all. So again, from this position, tuck that pelvis under, keep it there as you move forward. That's about as far as I can go before I start to feel a stretch there. From there, I'm going to have you hold for 3 to 5 minutes. If you're just getting started with this and you can't hold for 3 minutes to begin with, then go ahead and work your way up to that. But try to hold for a minimum of 3 minutes. The reason for that is, yes, we want to stretch the muscle, but we also want to get into the fascial layers, the connective tissue, which is going to give you more mobility into that muscle and into your joint, around the hip, the pelvis, and into the back. So take your time. Don't get in a hurry. You might be saying, you know what, I've tried this before and it didn't help me. Slow down. That one tip helps many of my patients, because a lot of times people are only holding for 30 seconds, maybe a minute, but most people are not holding long enough. So once you get to your 3 minutes, then you can switch legs. All right, so again, tuck in and coming forward. So give that a try and see if that helps you. I'm going to show you one variation of this same stretch in case you have knee problems and you need an alternative position. There are different ways to stretch the psoas and the hip flexors. However, I don't want to make this video really, really long. So if you cannot do what I just showed, what you can do instead is to come down onto your side. So I can be here, just going to rest my head down. What I can do from here is to straighten out my bottom leg. So I'm lying on my left side. I'm kicking my left leg out at an angle just to give me a little support. Then what you can do is grab this leg and that's on the top, grab it at the ankle or the foot, and what you can do is bend the knee and then start to pull back. Again, with this, you want to be careful that you are not actually allowing yourself to overly arch, because you won't feel much of anything. So you want to tuck that pelvis again and very gently pull back. Now, keep in mind, this is also a quad stretch. So you might feel a stretch into the front of your thigh before you feel anything into the front of your hip. That's okay. You want to work your way to feeling it into that hip flexor. Another tip there, if you're only feeling it in the thigh, what you can do is almost push this front of your hip forward to get it to stretch into that area. Again, you want to hold this for 3 to 5 minutes on each side. Work your way up to it if you need to. But for some people, this is a little bit more comfortable for their knees and for their body to hold this position for so long.